Assalamu alaikum and welcome back to another video. In this video we're going to understand the chest leads. So first I'll talk about how to place the chest leads over the patient. V1 we place it over the fourth intercostal space over the right sternal border. V2 just opposite over there, fourth intercostal space over the left sternal border. Now we won't place V3, we will instead place V4 which is over the apex. Now V3 we place in between V2 and V4. V5 over the anterior axillary line, V6 over the mid axillary line. So here's the patient and we're going to place the chest leads. So we said V4 we place it over the fourth intercostal space over the right sternal border. So 1, 2, 3, 4, fourth intercostal space over the right sternal border, that is V1. V2 over the left sternal border, same area, same intercostal space over the left sternal border. Now we won't place V3, instead we place V4 over the apex. Apex is somewhere over here. Then we place V3 in between V2 and V4. Now I'm going to divide the axilla into three parts, that is anterior axillary line, mid axillary line and posterior axillary line. We are not bothered about posterior axillary line, we are bothered about only anterior axillary line and the mid axillary line. So V5 will come over the anterior axillary line and V6 in the mid axillary line. So this is the way how we place chest leads over the patient. So by this time you would be knowing the house which I used to show to represent the trunk of the patient. So same way here I want to say the same thing. We're going to draw the same diagram of the house and we'll represent the chest leads of the house. Okay, so I'll just remove the legs and the hands and we'll be representing this trunk as the house. Okay, now this is the house, but I'm representing the trunk of the patient, and we learned that inferiorly it's, that is 2, 3 AVF were like windows over here. This 2, 3 AVF will be at the center, 2 on the either side, 2 and 3 on the either side, and we had AVL over here and D1 over here. Now chest leads are like if someone climb on top of the house and literally take out one tile from here. Okay, I'll just try to use another color. Okay, take out one tile from here. This will be like V2. And if you look through this hole, what part of the heart you'll be seeing? Obviously anterior part. Similarly, if you take another tile from here, this will be like V3. And another tile from here, it will be like V4. There's another tile over here which I cannot draw and show you. That will be V1. Okay, V1 and V2 represent septum. So if you look through V1 or V2, you are like looking at the septum. V2, V3, V4 represent the anterior wall of the heart. Okay. Now V5 is like you're making a hole on the wall over here. Okay, that will be V5. Okay, this will be kind of like anterior axillary line. Now at the mid axillary line will be digging another hole, that will be like V6. As I said before, V5 and V6 they join the anterior wall. But if you see, V5 and V6 are slightly lower than 1 and AVL. So V5 and V6 are looking at the lower lateral part of the heart, and 1 and AVL are looking at the upper lateral wall of the heart. Is that clear? So at the end of the day, we need to know only 3 walls. That is anterior wall, which is represented by V2, V3, V4. Lateral wall, which is represented by 1, AVL, V5, V6, and inferior wall, represented by 2, 3, and AVF. That's it.